Welcome to this deep dive, and we're going to be looking at some pretty amazing stories of healing. We're going to be taking a look at Pastor Jerry Easy's channel, Strange Acts of God. It features testimonies from his prayer program, NSPPD. It's Christmas time 2024, and Pastor Easy is wrapping up a week of live sessions with these incredible accounts of recovery.
What's really interesting here is these stories kind of blur the lines between what we think is possible in the realm of medicine.
Yeah, exactly. And to help us navigate this intersection of faith and healing,
Yeah.
we have with us Dr. Paul Unu. He's a consultant urologic surgeon who's going to provide some insightful medical perspective on these cases. So are you ready to delve into this world of strange acts of God?
Absolutely. I'm always fascinated by cases that challenge our conventional understanding of healing.
Great. Well, our first story takes us to the United States, where a man named Patrick experiences a medical mystery that seems to defy explanation. He goes to bed feeling perfectly fine, but wakes up with excruciating pain in his lower back radiating down his leg.
That sudden onset of severe pain is certainly concerning, especially when it comes to back pain, which can have a variety of causes.
Right, and in Patrick's case, he's diagnosed with sciatica and piriformis syndrome, which are conditions that involve the sciatic nerve. It's so bad that he needs walking aids to get around.
Now, the sciatic nerve is the largest nerve in the body, running from the lower back down each leg. Piriformis syndrome occurs when the piriformis muscle, which is located deep in the buttock, irritates or compresses the sciatic nerve. This can cause pain, tingling, or numbness that radiates down the leg.
So it sounds incredibly painful and debilitating. And as you mentioned, the causes can vary. What are some of the typical reasons someone might develop piriformis syndrome?
Well, it can be caused by a number of things, such as prolonged sitting overuse, or injury to the muscle, or even anatomical variations. In some cases, the exact cause is never really pinpointed.
Interesting. So in Patrick's situation, it sounds like it came out of nowhere.
Yeah, that sudden onset is unusual, although it can happen. It could be related to something as simple as sleeping in an awkward position or even a slight twist or strain during everyday activities.
Okay, so it might not be as mysterious as it first appears. But here's where the story takes a turn while struggling with this intense pain. Patrick happens to be watching Pastor Ize's live stream, and suddenly he hears Pastor Ize call out, "Piriformis syndrome be reversed."
And that's when Patrick claims to experience a dramatic shift.
Exactly. He says the pain vanishes instantly. He even stops taking his medications and attending physical therapy, which seems like a bold move considering he was in so much pain just moments before.
From a medical perspective, abruptly stopping treatment for a condition like this is generally not recommended. It could potentially prolong the recovery process or even worsen the condition.
So you're saying that even if he did experience some relief, it's unlikely that it would have been an instantaneous and complete healing.
That's right. Piriformis syndrome typically responds to treatment, but it takes time. We're talking weeks or even months of targeted therapies like pain management, muscle relaxants, physical therapy, and sometimes even injections to reduce inflammation and release the pressure on the sciatic nerve.
So Patrick's claim of instant healing really challenges the typical medical understanding of this condition.
It does, and it raises questions about whether there might be other factors at play, perhaps related to the power of belief or a placebo effect.
It makes you wonder if the conviction of his faith and the timing of Pastor Ize's declaration somehow triggered a physiological response that we don't yet fully understand.
Exactly. Some researchers believe that the placebo effect, which is the body's positive response to a treatment that has no actual medicinal properties, can be quite powerful. It suggests that our beliefs and expectations can have a tangible impact on our physical well-being.
That's fascinating. So even if there wasn't a direct supernatural intervention, the power of Patrick's belief, combined with the suggestion of healing, might have actually contributed to his experience of relief.
It's certainly a possibility worth considering.
Okay, let's move on to our next story, which takes us to the UK, where a mother named Gloria shares the story of her son Michael, who's battled severe asthma since childhood.
Asthma is a chronic respiratory condition that affects the airways, making it difficult to breathe. And when we talk about severe asthma, we're talking about frequent and intense attacks that can significantly impact a person's quality of life.
And Michael's case was particularly challenging. He had been struggling with it for 18 years, enduring ambulance visits, a constant fear of suffocating, and limitations on his everyday activities. Imagine living with the worry that a simple meal could trigger a life-threatening attack.
It's a lot for anyone to bear, let alone a child. And it highlights the ripple effect that chronic illnesses can have on families.
Right, the stress and anxiety must be immense for both the sufferer and their loved ones. So Gloria decides to take Michael to Pastor Ize's NSPPD conference, hoping for a miracle. They pray fervently for his healing. But later that night, Michael has a severe attack.
It's those moments of crisis that can truly test one's faith.
Absolutely. And while it would be easy to lose hope in that situation, Gloria chooses a different path. Instead of calling an ambulance, she decides to double down on her prayers, desperately seeking a way to help her son.
And her persistence leads her to an unexpected discovery.
You're telling me while searching for a prayer specifically related to breathing problems, she stumbles upon a video from 2021 of Pastor Easy praying for those struggling to breathe. She decides to play it, and as the prayer fills the room, something remarkable happens.
This is where the story takes on an almost cinematic quality.
I know, right? It's like a scene straight out of a movie. As the prayer plays, Michael, who was struggling to breathe just moments ago, falls asleep peacefully. When he wakes up, he's breathing freely.
It's a dramatic turnaround, and it's easy to see why Gloria would attribute it to divine intervention.
Right, but it gets even more incredible. Gloria takes Michael to the doctor, and they confirm that his asthma is completely gone.
Now, this is where medical evidence enters the picture. It's not just a subjective experience. There are objective measures that can show a change in lung function.
And in Michael's case, the change is pretty dramatic. His lung capacity tests show results that exceed even normal levels. It's almost as if his lungs were suddenly supercharged.
That's quite a remarkable improvement, especially given the severity and duration of his condition. So the question becomes, is spontaneous remission of asthma even possible? And if so, how common is it?
That's a great question, and it's one that we'll explore further along with the medical plausibility of such a dramatic turnaround as we continue this deep dive.
Yeah.
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 Yeah. So you were saying that spontaneous remission of asthma is possible but rare. How do Michael's lung capacity results fit into that?
Well, it's important to understand that spontaneous remission usually happens in cases of mild asthma, and even then it's not fully understood why it occurs. Some researchers believe it could be related to the body's natural immune responses or changes in environmental triggers. However, Michael's case, with its severity and sudden turnaround, is certainly unusual.
Yeah, it seems to defy what we typically expect from a medical standpoint. Do you think there's any possibility that the power of prayer or belief could have played a role in his recovery?
That's a question that has intrigued scientists and theologians for centuries. While we can't scientifically prove or disprove the influence of prayer, there's growing interest in the field of psychoneuroimmunology, which explores the connections between our thoughts, emotions, and immune system. Some studies have shown that practices like meditation and prayer can have positive effects on stress hormones and immune function.
So it's possible that Michael's deep faith and the fervent prayer surrounding him could have created a physiological environment conducive to healing.
It's a fascinating concept to consider. Of course, there's also the placebo effect, which we discussed earlier. The belief in a treatment, even if it has no inherent medicinal properties, can trigger real physiological changes in the body.
Right, so perhaps a combination of factors, including Michael's own belief in healing, the support of his mother and their community, and maybe even a placebo effect triggered by the prayer, all contributed to this remarkable outcome.
It's certainly a possibility worth exploring. These cases highlight how much we still don't know about the complexities of the human body and its capacity for healing.
Absolutely. Okay, now for our final story, we actually have two testimonies that intertwine, both involving individuals facing very serious cancer diagnoses. First, we have Chiazoka, a mother whose 6-year-old son is diagnosed with a brain tumor. And it's not just any tumor. It's aggressive and is spread to his spine.
Childhood cancers, particularly brain tumors, are incredibly challenging to treat. They often require a multi-pronged approach, including surgery, radiation, and chemotherapy, each with its own potential side effects.
So it's a terrifying and heartbreaking situation for any parent to face, and the prognosis for aggressive brain tumors can be quite bleak.
That's true. The survival rates vary depending on the type and stage of the tumor, but the chances of complete remission are often slim.
So Chiazoka is understandably desperate for a miracle, and while watching NSPPD, she hears Pastor Ize call out a child with heart problems, declaring healing over them.
It seems that many of these testimonies center around this idea of the spoken word carrying a certain power.
Yeah, there's a strong emphasis on the declaration of faith, and even though her son's condition is different, Chiazoka claims that prayer for her son as well.
And shortly after, Pastor Eze specifically mentions brain tumors and declares healing over those as well.
It's almost as if there's a synchronicity at play, a connection between the spoken word and the specific needs of the viewers.
It's certainly a compelling narrative.
And here's the incredible part. A year later, Chiazoka's son undergoes follow-up tests, and there's no sign of cancer complete healing.
That's an extraordinary outcome given the initial diagnosis. It raises the question of how often spontaneous remission occurs in cases like this.
Do we even have statistics on that?
It's difficult to say for certain. Spontaneous remission, particularly in cases of advanced cancer, is extremely rare and not well documented. Some researchers believe it might be more common than we realize, but it's often attributed to misdiagnosis or other factors.
So it's possible that there are cases of spontaneous remission that go unnoticed or are dismissed as medical anomalies.
Exactly. And that makes it challenging to study and understand these phenomena from a scientific perspective.
Okay, now for the second part of this double miracle story, we have Auku, a woman diagnosed with metastatic breast cancer. This means the cancer has spread from her breast to other parts of her body, including her bones, liver, and lungs.
Metastatic cancer is often very difficult to cure. Treatment at this stage usually focuses on managing symptoms, slowing the progression of the disease, and improving the patient's quality of life rather than completely eradicating the cancer.
And that's what Auku was told the doctors advise against further treatment, saying that it's only a matter of time.
It's a devastating prognosis, especially for someone with young children.
Absolutely. Imagine having to make end-of-life arrangements knowing that your time is limited. But despite this bleak outlook, Auku decides to attend NSPPD, seeking solace and hope through prayer.
This speaks to the potential power of faith and spiritual practice, even in the face of adversity. For many, it provides a sense of comfort, purpose, and connection that transcends the physical realm.
Right, it can offer a sense of hope and meaning even in the darkest of times. So Auku begins attending NSPPD, initially overwhelmed with grief and fear. But as she immerses herself in the community and the prayers, something shifts within her. She finds a sense of peace and strength that she hadn't felt before.
It's interesting how the social and emotional support of a community can impact our overall well-being. Studies have shown that strong social connections can have positive effects on both mental and physical health.
Yeah, that makes sense. Feeling loved and supported can make a huge difference, especially when facing difficult challenges.
Absolutely. It can reduce stress levels, boost our mood, and even improve our immune function.
So Auku continues attending NSPPD, finding strength and solace in the prayers and the community. And while on palliative care, which is not intended to cure the disease, but to manage symptoms and improve comfort, she undergoes further tests.
And the results are quite unexpected.
To say the least, the tests show complete remission. No signs of cancer anywhere in her body.
This is one of those cases where even medical professionals are often left speechless. When a patient with such advanced disease suddenly shows no signs of cancer, it challenges our understanding of what's medically possible.
It's hard to argue with the doctors who call it a miracle. 10 months later, further scans confirm that she's still cancer-free.
It's truly remarkable. It makes you wonder about the body's self-healing mechanisms and the potential for factors beyond conventional medicine to play a role in recovery.
So we've just heard 3 stories of seemingly impossible healings, each pushing the boundaries of medical explanation and raising profound questions about the interplay of faith, prayer, and the human body's potential for healing.
These stories invite us to consider a broader perspective on health and well-being, one that acknowledges the potential for factors beyond the purely physical to influence healing. It's a reminder that our understanding of the human body and its capacity for recovery is constantly evolving.
What are your thoughts on the role of faith in healing? Do you think there's something more at play here than just medical science can explain?
Well, as a medical professional, I'm trained to approach healing from a scientific perspective, focusing on evidence-based treatments and interventions. But I also recognize that there are aspects of the human experience that go beyond our current scientific understanding.
I think that's what makes these testimonies so fascinating. They challenge us to expand our thinking about what's possible and to explore the potential interplay between faith, belief, and the healing process.
Absolutely. And while we may not have all the answers, I believe it's important to keep an open mind and to approach these cases with a sense of curiosity and humility.
You know, as we've been discussing these stories, I keep coming back to this idea of the placebo effect.
Yeah.
You mentioned earlier that it can have a significant impact on our physical well-being. Do you think it's possible that the power of belief combined with the fervent prayers and declarations in Pastor Azi's ministry could be triggering a kind of mass placebo effect?
That's a thought-provoking question. The placebo effect is a complex phenomenon that we're still trying to fully understand, but it does seem to suggest that our beliefs and expectations can have a tangible impact on our physiology.
So even if there isn't a direct supernatural intervention, the power of collective belief could be playing a role in these seemingly miraculous recoveries.
It's certainly a possibility. Imagine a scenario where individuals are deeply immersed in a community of faith, surrounded by powerful affirmations of healing, and witnessing firsthand accounts of others who claim to have been healed. That kind of environment could create a powerful expectation of healing, which combined with the placebo effect might trigger real physiological changes in the body.
It makes a lot of sense. It's almost as if the collective faith and expectation become a kind of self-fulfilling prophecy. And when you combine that with the potential for spontaneous remission, which we know does occur, albeit rarely, it starts to paint a more nuanced picture of how these healings might be happening.
Exactly. I think it's important to remember that we're dealing with complex systems here. The human body, the mind, the interplay of belief and biology, and there are likely multiple factors contributing to these outcomes.
These stories really make you wonder if we're just scratching the surface of what's possible when it comes to healing. Perhaps we need to explore a more holistic approach that takes into account the powerful connection between mind, body, and spirit.
I couldn't agree more. I believe the future of medicine lies in integrating our scientific knowledge with a deeper understanding of the human experience, recognizing the potential for factors beyond the purely physical to influence health and well-being.
It's a fascinating and ever-evolving field, and these stories from Pastor Aze's ministry offer a glimpse into the power of belief and the mysteries of the human body. Who knows what other strange acts of God might be happening around the world, waiting to be discovered and understood.
Indeed, it's a reminder that there's still so much we don't know, and that the exploration of healing in all its forms is an ongoing journey.
Well, on that note, I want to thank you for sharing your expertise and insights with us today. It's been a truly thought-provoking conversation.
It's been my pleasure. I always enjoy exploring these topics that challenge our conventional thinking and encourage us to expand our understanding of the world.
And to our listeners, we leave you with this final thought. Perhaps the most extraordinary healings begin with the willingness to believe in the possibility of something beyond our current comprehension. Keep exploring, keep questioning, and keep an open mind to the wonders that lie beyond the realm of what we think we know.